Hello all, this is Dr. Shivani Mangal, a root canal specialist practicing in Dwarka, New Delhi. As I mentioned in my last video, when the cavity of the tooth reaches the third layer of tooth, that is the pulp, that is when you need to get a root canal treatment done for your tooth. So in today's video, we will discuss what is this RCT or root canal treatment procedure. First of all, there is no need to be scared or worried if your dentist or endodontist tells you that you need to undergo an RCT procedure. Gone are the days when RCT used to be a very painful experience. Today we have the most advanced technologies that makes it a very simple procedure, just like a tooth filling. So what basically is done in root canal treatment? The infected pulp of the tooth is removed. The empty area is cleaned and disinfected carefully, and then it is filled with an inert or a biocompatible material known as gutta-percha. Once RCT is completed, now the tooth has to be given a cap. Now, very important to understand, whenever you get a root canal treatment done for your tooth, you need to get capping done after it, because the brittleness of tooth increases and it becomes 3 times more prone to fracture if capping is not done. Now, root canal treatment procedure, there are many doubts related to it, but before discussing that, let me just tell you some symptoms wherein you can have a check on your tooth at home and you can come to know that your tooth might require root canal treatment. First is, if you feel lingering sensitivity to hot and cold in your tooth, then that tooth might require RCT. Secondly, if you feel spontaneous sharp pain while chewing or biting. Third, if you see some pimple kind of swelling or growth in your gum area. And fourth, if you see some crack in your tooth or chipping of your tooth, then mostly that tooth will require root canal treatment. Now coming on to the doubts or facts related to RCT, the first and foremost doubt which prevents the patients to come and get their RCT done. Is RCT painful? Not at all. It is entirely painless procedure. We give local anesthesia for this treatment. The area becomes numb. The procedure is done very comfortably. Followed by that, medication is given for 3 to 4 days. You might feel little soreness in that area for 3 to 4 days, but that can be very well managed. So RCT is not at all painful. It is done in a single or a 2 sitting depending upon the infection of your tooth. And the second doubt, how much will RCT cost? Now if I talk about the cost, that really depends upon the type of tooth. For example, if you are getting it done for your posterior teeth like premolars and molars, which are a bit difficult to treat as compared to your anterior teeth, then they would be at a higher range. But any day, RCT is very less expensive as compared to getting your tooth removed and replacing it with an artificial one. Saving the natural tooth is very important for you to maintain your natural smile, for the functioning of your tooth. And believe me, if root canal treatment is done properly and if you maintain it properly, you can have your tooth, root canal treated tooth, just similar to your any other natural tooth for a lifetime. So please be aware of the symptoms. Please come for a checkup, get your tooth treated and enjoy the foods that you love. Thank you so much.